Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Health, Seniors, and Long-Term Care. Questioning for this department will proceed in a global manner. The floor is now open. Questions? Member for Portage La Prairie.
Thank you so much, Honorable Chair. I just want to make sure I get this correct. It is Honorable Chair? Thank you. Honorable Chair, 3 months ago, wait times in Southern Health for MRIs were approximately 6 to 8 months. Today, that wait time has skyrocketed to 10 months. This is the longest waiting period of time in all of the province. What is the government currently doing to alleviate the number of weeks waiting in the Southern Health region?
Thank you, Member. Honorable Minister.
Thank you, Honorable Chair. While I wait for a bit more information, I'll take the opportunity to talk a bit about what we're doing on the diagnostic side. You know, MRIs, the technology is just technology without having people to staff them. I think the member is well aware of that. I had the opportunity to meet with physicians in Portage la Prairie to hear from their perspective what their priorities are. They actually made clear that mammography was a greater priority, making sure that breast cancer screening accessibility was more accessible rather, and you know, there were concerns expressed about the approach that the member for Portage la Prairie has taken. However, everyone was in agreement that more capacity generally is what's needed. We need more capacity in healthcare. And what I found really fascinating, you know, it's a big, beautiful, much larger footprint hospital that's being established now in Portage la Prairie. And one would think that the previous government had done their due diligence and really done the work to identify how they're going to staff it. And they didn't, you know, which is really concerning, really, really problematic. And so, as the member is well aware, our government has made very clear that our priority is first and foremost to staff the front lines of the healthcare system, that a bed is just a bed without people to provide care at the bedside, that a building is just a building without people in it to provide services to Manitobans. And so our top priority has been to make sure that we are doing the work of retaining folks in the healthcare system, that we are training more folks to have a path to practice in our healthcare system no matter where in the province they want to serve in healthcare, and that we are actively recruiting folks. And so the member, given the fact that mammography is such a big priority, certainly in the Portage community, and physicians have identified that, I'm happy to share with the member that our government has taken steps to proactively recruit folks, technologist students, into the path of taking additional training for mammography so that they can get a job right away in that area of healthcare. And that's an approach we're going to continue to take to make sure that we're reaching out to learners while they're learning, before they graduate, to let them know about the opportunities that are available to them to get more training, the opportunities by way of employment in our own province. Whereas previously, folks were not hearing from anybody consistently at all in terms of what the opportunities were that existed for them, particularly in rural Manitoba. And as a result, we were losing folks to Saskatchewan and other jurisdictions because they were literally coming into our classrooms and letting people know about the jobs that existed in their jurisdictions. So we've taken a different approach. We're proactively reaching out to student learners. We're letting them know about the additional training opportunities, providing supports so that we lower those barriers for them to get those training opportunities, and that we are giving them a letter of offer for employment before they graduate. And we've seen success as a result of taking that approach. Portage la Prairie, you know, there's a lot of effort right now being put into making sure that we have a strong sense of the healthcare human resource capacity that's required. When we met with the physicians and leaders there, we really sent them away with this ask of, like, really outline for us what that needs to look like, right? I know that you were never given any indication from the previous government or direction around having a strong plan in place in that regard, but we really do need to know what additional human resource we're going to need to properly staff this hospital, and what areas that perhaps we need to be paying closer attention to than others. So certainly, you know, our government has prioritized doing the work of staffing the healthcare system. We have a net new over 1,600 healthcare workers on the front lines of our healthcare system, including in Portage la Prairie, including across rural Manitoba. It's not nearly enough. There's a tremendous amount of work that we need to do in order to continue to move in the right direction. We're committed to doing that. And we're committed to continuing to meet with and learn from the experts in Portage la Prairie who just want to work in partnership. You know, these are folks who didn't have the opportunity to sit down with former government and offer their insights, and our door is wide open for them. We want to sit with them, have those conversations, know where the priorities are, or where their needs need to be met, and make sure we're taking the right steps. Diagnostics is a huge priority. You know, we're recruiting a number of new doctors. We have a net new over 160 physicians in this province, a number of them in rural Manitoba. We need to make sure that when we've got all of these new doctors, that we also have a diagnostic capacity to meet their needs, right? Because they're requesting more tests and procedures for their patients. And so we're working directly with the leads on this to make sure that we have a plan in place to retain and to train the workforce we need to provide those services.
Thank you, Minister. Honorable Member for Portage La Prairie.
Thank you, Honorable Chair, and thank you to the Minister for those questions. Just so that we're on the same page, I'm on the gov.mb.ca website that diagnostic services MRI scans if you wanted to compare notes on that and where those wait times are coming from. My question to the Minister is, in speaking with a number of the techs at St. Boniface and at Health Science Centre regarding MRIs and other diagnostic equipment, a number of our students in Manitoba and Manitoba are having the opportunity to do distance education with the Northern Alberta Institute of Technology and the BC Institute of Technology, I believe it's called. The issue is that we're losing some of those people because they're being offered jobs, by taking that. Is there any look right now from the department looking at offering something like a distance education through Red River or whoever it may be here in Manitoba? Thank you.
Thank you, Member.
Yeah, that's a really...
Honorable Minister.
Thank you, Honorable Chair. Sorry for jumping the gun a little bit there. That's a really great question. I really appreciate that question, asking about what are we doing to make post-secondary training opportunities more accessible for learners who want to pursue that career path. What I can tell you is that all options are on the table for our government. Our department works very closely, and the member will know that our department is not responsible for post-secondary education. That's the minister responsible for advanced education and training. So some of these questions might be better posed in that estimates. But what I can say is that we work very closely together. And healthcare is our government's #1 priority. So really, we're taking an all-of-government approach to finding new and innovative ways to meet the evolving needs of student learners. We cannot be stagnant. We cannot be stuck in the past in terms of what we do to engage more learners in these opportunities. What I can say is that before coming into this role, I didn't actually know the pathway for folks to become technologists. And when we started to really unpack that, it became very clear it's not intuitive. It's not a straightforward process that would necessarily from start to finish really entice a student learner to start and then finish that program in its entirety. And so we've been working very closely with Red River College, with post-secondary institutions to explore ways that we can improve that pathway and that process. Everyone agrees we have to do better. This was actually flagged years ago. There was no political will at the time to make those changes. We are highly motivated to make sure that Manitoba students, learners, people who want to pursue a career in healthcare are able to do so in a way that makes sense intuitively, that is low barrier, and that meets their needs no matter where they live. And so we certainly are exploring many different approaches to making sure that we can train more technologists. To grow your own approach is really important, making sure we have more training opportunities in rural and northern communities for student learners. Of course, virtual options are being explored. What can we do with our capacity here? And what is appropriate to be done that way? I've also heard from folks who've been technologists for a long time that they're eager to provide mentorship, which I think is really wonderful. I had a great conversation with a woman in rural Manitoba who has been a technologist for at least a couple of decades, maybe longer. I think it's at least 2 decades. And she had a lot of ideas, strong thoughts and feelings on what's going on in healthcare. We had a really spirited conversation, and she ended with, and I would love to mentor the new learners or anybody who's even interested in pursuing this path. They don't even have to be enrolled or be a student. I would love for them to come down to my workplace, see what we do, and get a sense of what their career could look like. And I thought that was really generous, and I also thought it was kind of a common sense approach. So one of the other things that we've been talking about is how do we get younger learners engaged? How do we make sure that by the time you're in middle school, by the time you're in high school, you have a good sense of what these career opportunities can look like and how you would be able to access them. I know for myself, and I've shared this before, I had no idea that I actually, when I was a kid growing up, I didn't want to be a healthcare worker. Full honesty, I wanted to be Michael Jordan. That wasn't in the cards for me. I wanted to play professional basketball, right? Worked really hard for that. But some of the experiences I had as a kid, volunteering at a personal care home in my community, volunteering at the local hospital, that planted the seed for me that healthcare could be a really great place to have a career, and that you can really make a difference in people's lives by being a part of those really important multidisciplinary teams. And so we want for as many students across the province to have those opportunities. And what we've done is we have looked at models like, there's a learning model at St. Boniface Hospital as an example. There are models out of UCN where they're engaging young learners, and we're seeing the benefits of that. We want to apply that approach and those approaches to the area of technologists in post-secondary education. So there's a number of things that we're looking at in terms of how we improve this area. We are also looking at, we've already expanded and added seats, training seats, but we believe we're going to have to go further in that regard. It's just a matter of, as you've aptly identified, how do we make sure that those seats are established in a way that really meets the needs of young learners or all learners, and we're doing that work in conjunction with advanced education and training.
Thank you, Minister. Honorable Member for Portage La Prairie.
Thank you, Honorable Chair, and thank you for the answers, Minister. I appreciate that. Looking at education again, and I understand you said that you work closely with education. In my past, when I was a little younger and going to school, there was a Candy Striper program. I knew at that time I wanted absolutely nothing to do with healthcare. Is there a want by this government to look at things like a Candy Striper program again starting in middle and high school?
Thank you, Member. I would remind all members to put their questions and answers through the chair, please. Thank you. Honorable Minister.
Thank you so much, Chair. I am going to answer this question, provide a bit of clarity for the member, and then I'll go back to his prior question on diagnostic services and MRIs. So the advanced education and training does the post-secondary and the training pieces. K-12 education would really be responsible for what that looks like in terms of youth engagement. So we do work together. Our role as the Department of Health is really to provide clarity to the Minister of Education and their department in terms of where the best opportunities are, where the needs are for young learners to be able to participate. And then ultimately schools and school divisions, they design the program, my understanding anyhow, and again, this is a question better posed to the Minister of Education's department. So if I misspeak on any of this, I apologize. But my understanding is that then the school divisions and schools themselves will design a program in partnership with different sites, perhaps with the regional health authority, and they will deliver that program for students. I had the opportunity recently to have a good conversation with physicians and researchers at St. Boniface Hospital, just as an example, and with the St. Boniface Foundation Board. And they've done really incredible work engaging Indigenous student learners in K-12 and to find ways of developing a full program where folks can go in and learn about cardiac health and learn about cardiac sciences well before they're even in university, which is really exciting. And as a result of that approach, they've seen student learners want to pursue medicine. They've seen them want to pursue other healthcare opportunities. So I recognize for the member that his experience resulted in the opposite, but for many other young folks, including myself, the opportunity to volunteer and be in healthcare settings early left a really positive impression. And, you know, for a lot of folks, we know that hospitals can be kind of a scary place. You know, those can be environments that people associate with negative experiences or challenges. And reframing that early is so important. It's so important for young folks to know that hospitals are safe places, that they are places where people heal, where they're connected to really important care, where whole communities can be healed through the work of what happens at community sites and healthcare institutions that focus on making people healthier for the short and long term. And so, you know, as the Department of Health, our role is really to identify these areas of opportunity. Often maybe provide an introduction or a bridge in terms of bringing education and healthcare together. One other area that we've seen be very effective is the introduction to healthcare aid training for high school students. So that's an area for us that we know we really need more folks on the front lines. And what we've been able to do is work with the Minister of Education's department, identify opportunities and where the needs are, and then school divisions, sites have been able to design a program and work with different locations so that youth can get those experiences and actually get their healthcare aid certification. So not only, it's not even volunteering, it's employment. These young people can be gainfully employed, earning an income, learning about healthcare, and proactively giving themselves an opportunity to ladder their skills up much earlier on. You know, whereas someone in their 20s or 30s or 40s or 50s maybe becomes a healthcare aide and then decides, you know what, I want to become an LPN, or I want to become an RN, or a physician, or a technologist, something else, because I'm comfortable with healthcare now. We're allowing these young folks to get this training, this education, and then the experience and gainful employment and relationships in the workplace that will allow for them even earlier on in their careers to pursue further opportunities in healthcare, which I think is just really wonderful. When I was working on the front lines as a nurse, I worked with some pretty young healthcare aides. It was really great to see people in their very early 20s working in that role and seeing how their ambitions might change over time and knowing that they could pursue those opportunities at sites or in regional health authorities where they've already formed relationships and where people really want to see them succeed. And so we're working really hard to facilitate more of that through our department.
Thank you, Minister. Honorable Member for Portage La Prairie.
Honorable Speaker, thank you. Thank you to the Minister for the answer to that question. Minister, I just want to make it clear and to this committee that it was the doctors from Portage La Prairie that reached out to me regarding the MRI. I'm also glad to hear that the Pink Ladies from Portage La Prairie are purchasing the mammography machine or are working on purchasing the mammography machine for the Portage Hospital. The, you know, when it comes to, again, I'm sorry I wasn't part of the PC government when we were designing. Thank goodness the hospital is going into Portage La Prairie. It's going to make a tremendous difference there. I've made it very clear to the press a number of times that if I could stand up on the top of the Golden Boy and take blame for not having that MRI in Portage La Prairie, I would do that for the amount of people that are waiting for MRIs. So again, with Portage La Prairie, and again in hearing from from the docs that have said to me that they believe that the MRI in Portage la Prairie could be one of the busiest MRIs in Manitoba because of our location. And again, when we look at the Grace Hospital in Winnipeg, where a lot of these patients are coming from as well too, out to meet with doctors in Portage, their wait time is 39 weeks at the Grace Hospital, according to that website again. So again, Portage la Prairie would be a great opportunity there. With the walls and that all closed in of the hospital, we know that's not likely to happen, or it would be much more costlier. But I know in talking to the Portage Hospital Foundation, there is still a want there that they have come to me with as well too, that they would be willing, again, the $5 million that they said they would do is still on the table. But in understanding the cost now, because of walls all closed in and electricity and all the rest of that, to tear a wall out of a new hospital just probably isn't the best thing to do right now. Surrey, BC just purchased an MRI, a mobile MRI, at a cost of $3.6 million. There's other municipalities as well in Portage, and I'm thinking there's you know, just off the top of my head, there's a hospital roughly 90 kilometers down the way on number 16 highway in Neepawa that I know doesn't have you know, a CAT scan or an MRI in it as either. Is there an opportunity that maybe a number of these hospitals to alleviate the lengthy wait times that there is? And I know we have you know, there is a shortage of people out there, but there's also a number of people I understand that are taking some of these distance educations. Is there an opportunity to look at mobile, like are going in up in the north, to offer some relief on some of these patients that are waiting up to 10 months for an MRI? Thank you, Honorable Speaker.
Thank you, member. Just a gentle reminder to all members to put the questions and answers through the chair, please. Thank you. Honorable Minister.
Thank you, Chair. Good. Thank you, Chair. So just to provide a bit of information for the member in terms of MRI capacity and diagnostics, and I want to be really clear. Our government is focused on staffing the healthcare system. It is much easier, and I know the member opposite wasn't a part of the PC team when this was happening, but it is much easier to cut a bed than it is to add a bed. It is much easier to close an emergency room than it is to build and establish an emergency room. And so I think it's really important, and sometimes, you know, the member or members on his team or his caucus will say to me, you know, stop bringing up the past. Well, the past is how we got here. And Manitobans are dealing with the ramifications of the past in the present. And so I'm always going to put on the record the realities that we are dealing with we're dealing with massive challenges in the healthcare system as a direct result of an irresponsible and reckless approach to healthcare that was short-sighted and did not prioritize the healthcare outcomes of Manitobans. And so when we talk about adding capacity, and we talk about adding staffing, it is not just as simple as adding training seats at post-secondary institutions. It is about changing the culture of healthcare and doing the work to ensure that people want to pursue a path and a career in healthcare. It's about creating opportunities for healthcare workers to practice to their full scope, to know that they are respected, to have collectively bargained agreements that allow for people to actually have work-life balance and know that their hard work on the front lines is being fairly compensated. Those are all things that were denied from healthcare workers, including the same people who staff MRIs for years. Allied healthcare professionals had their wages frozen for almost 6 years, and during a pandemic. Knowing the member for Portage la Prairie, I don't think that is something the member believes was appropriate or right or contributed to healthcare being better. It didn't. It did a lot of harm, a lot of damage that we are still fixing and cleaning up in the healthcare system. And so much resource, government resource. The 25-26 budget has a $1.2 billion increase, a 14% increase to healthcare. 780 million of that is wages. That's healthcare worker compensation. That includes the very same technologists who staff MRIs. And we have more work to do. We have more to do to make sure that we have these folks pursuing this career path and that they are working in environments where they really feel fulfilled in their roles. And so the work that we've been doing is in partnership with Diagnostic Services Manitoba. It's working with the experts in Manitoba who understand that you cannot just add an MRI anywhere because you feel like it or because it's a priority or because we want it to happen. You have to have a plan. You have to have the staffing and the resource in order to make sure that that machine is used to its full capacity. There's a number of scans, a number of tests you have to be able to run in order for it to be working optimally, and for the technologists to be able to meet their own standards in terms of practice, right? And you also need to make sure that clinically, when you look at the whole province, when you look at the whole system, that you understand why you're making those investments, which is why our government took the step of having an MRI in the north. They've never had diagnostic technology of that kind, which is unacceptable, and it's long overdue. But in able to do that, we had to make sure that we spent, the year and a half leading up to that, training, recruiting, retaining, and doing the work so that it could be successfully staffed. That takes a tremendous effort. And so, our government is certainly always open and willing to listen to how do we evolve healthcare? How do we make sure that the citizens of Portage la Prairie and surrounding communities have the diagnostic services they need? We're always going to continue to listen to the experts and work with them to make sure that how we roll out diagnostics is done in an intentional, thoughtful, sustainable, achievable way that really delivers for Manitobans. We work directly with diagnostic services to ensure that we're taking that really comprehensive and thoughtful approach, an approach that the member acknowledges himself was absent from the previous government who made certain decisions in that moment, but perhaps were not planning as far enough as they should have ahead in terms of staffing. And we're doing the work now of addressing that human resource capacity reality that we know is present not only in Portage la Prairie, but across the province. In my next response, I'll speak to some of the numbers the member was referencing and provide him a bit more accurate information.
Thank you, Minister. Honorable Member for Portage La Prairie.
Thank you, Honorable Chair. Through you to the Honorable Minister. The foundations such as Portage Hospital Foundation, the Health Science Foundation, the HSC Foundation, Grace Hospital Foundation, Brandon, all these, it's private money coming into the foundations. Are the foundations viewed as private funding that is coming into the foundation or into the healthcare system? And is that not the start of private healthcare through the money that's coming in from the foundations? Thank you, Honorable Speaker.
Thank you, Member for Portage. Honorable Minister.
Thank you, Honorable Chair. I just want to go back to the question about student learners and share with the member that, just to get clarity on his question about volunteer opportunities for students in healthcare settings. So the member, I don't know where anywhere that references those programs as Candy Striper programs anymore. They might still, I'm just not sure. I know that in Manitoba, we reference those programs as student volunteer programs. And they are running all over the province. So we've got several running at hospitals, personal care homes across Manitoba, which is really wonderful. But I do want to highlight one particular program. It's the Mashkiki Mushkwa program. It's the Medical Careers Exploration Program. And that's a program that was established by Pan Am Clinic in partnership with the WRHA and HSC Foundation, speaking of foundations. And it's a wonderful program. They have 100 students every year for this program. I'm just going to read directly from their website to give you a bit more information on this program and why it's so important and impactful. It's a program that inspires and supports Indigenous youth to learn about, experience, and pursue a wide range of careers in healthcare. MCEP was launched by the Pan Am Clinic Foundation in 2007. The program provides students the opportunity to immerse themselves in more than 20 different healthcare environments across Manitoba, including Health Sciences Centre. HSC participates in one of the program's core components, Practicum Days, which allows students to gain an in-depth understanding of a wide range of health careers, from healthcare aides and MRI technicians to doctors, nurses, and surgeons. They can job shadow, they can learn hands-on skills in labs, and they can attend and participate in panels and one-on-one discussions with healthcare professionals. It's really a phenomenal program. I've had the chance to have the conversation with some of the folks at Pan Am about this. It's an opportunity that we know has tremendous benefit to not only these students, their communities, but also our healthcare system. And that's the approach that we want to see more of in our province, right? In particular, we want to make sure that diverse communities have an opportunity to get access to these volunteer roles and jobs as early as possible. We know, because science and evidence tells us, and I think anybody with on the right side of morality and decency would say that we want everybody who provides healthcare, we want them to also look like the people they serve, have shared in similar experiences. We know, the evidence tells us very clearly that when you have representative healthcare workforces, a diverse workforce, you support and facilitate innovation, it fosters creativity and shared learning, it enhances relationships, It allows for diverse problem solving and ideas to come to the table in the forefront, which really improves patient outcomes. We know that. And so certainly in Manitoba, a very diverse province that we live in, we should be very proud of. It's one of our greatest strengths. We want our workforce to be diverse, which means that we have to engage diverse learners as early as possible and make sure that we understand what their barriers are, what the barriers are rather that exist, that prevent them from accessing these opportunities, getting rid of those barriers and making sure that they have a fair shot at choosing that path. And this program is a really great example of that. And we're going to continue to work with Minister of Education, Minister of Advanced Education and Training to create more of those opportunities. To the question the member asked previously around MRIs, I do want to be clear that the wait times for MRIs in Southern are actually coming down. The wait times are at about 7 months, 31 weeks right now. And actually in March, we did more MRIs in that month of March, 776, than we've done in the past 24 months. We are doing more MRIs than we ever have. We're bringing the wait times down. Less Manitobans are waiting for those MRIs, but we recognize there's much more work that needs to be done. So we're working with Diagnostic Services Manitoba to develop more and new approaches to addressing those wait times and building more capacity.
Thank you, Minister. Honorable Member for Portage La Prairie.
Honorable Chair, thank you very much, and thank you to the Minister for the answer to those questions. Through the Chair to the Minister, my apologies. The only information that I have is what I currently have on the internet today from Diagnostic Services, and that's where those numbers came from. Moving along, because again, I think the health facility, the new health facility that the PC's brought into Portage La Prairie is second to none. It's amazing. It's beautiful. I'm sorry I haven't been allowed to be through there in the last number of months, but everything I'm hearing is it's beautiful. I am also working very diligently and happy to say that I've helped recruit 3 nurses to the new facility. I'm currently working right now with 2 young ladies, one from Morden, Manitoba, and one from Boissevain, Manitoba, that have taken their education. They played hockey down at Minot State University. One is a BN, one is an RN. They have currently been working for over a year now to try and get registered in the province of Manitoba. Currently, the one that's in Morden is working as a healthcare aide and is also working as a RN in the US, I believe it's in Grafton, North Dakota, she said. The one in Boissevain is not working in the healthcare field anymore right now. But through the you, Chair, to the Minister, what are we doing to try and recruit these out-of-province and out-of-country nurses that are waiting this excess amount of time? The one nurse that is currently not in the field, she has a spouse that's here in Manitoba. Otherwise, she said she would be in Alberta because she said that it was much easier to access and be able to get what she needs. And my apologies, I'm not sure exactly what it is that she needs. But again, these are the people that we want to retain and keep in Manitoba, these young families. What do we do to do that? Thank you.
Thank you, Member. Honorable Minister.
Yeah, thank you so much to the member for bringing this forward. I likely have already been in contact with at least one of the nurses that you're speaking of. I've said this before in committee. I really encourage the member and other members of the PC caucus, bring these concerns forward directly to me as quickly as you can. These are priorities for our government. We work very, very quickly and aggressively to make sure that we address those concerns that are brought forward. I welcome, whether it's an email or a phone call to let me know or pull me aside in the chamber to let me know. And I will always make sure that we're following up expeditiously to address those issues. I agree with the member. The amount of time that it's historically taken nurses who are trained in other jurisdictions to get their license to practice in Manitoba has been too long. It's been unacceptably long. We know that this has been a long-standing issue. Our government came into office knowing that this was a long-standing issue and sat down immediately and met with the College of Nurses, Registered Nurses of Manitoba, the Licensed Practical Nurses of Manitoba, the College of Registered Psychiatric Nurses of Manitoba, to get everybody at the table and have a conversation about how we work together to expedite those pathways. And those are very key relationships. We want to make sure that we are, as a government, doing our part to support regulators being able to function. We also need to make sure as a government that we are doing everything we possibly can to ensure we have people on the front lines of our healthcare system who are trained, ready, and willing to practice. And so we have worked directly with the College of Registered Nurses of Manitoba to, quite frankly, push them to do better, to work with them, to see how we can collaborate and partner where appropriate to eliminate those barriers, to make the timelines as quick as possible while making sure that patients remain safe in receiving care. I'm happy to share that as of May 20th, there will be an expedited pathway for U.S. trained nurses to be credentialed and licensed to practice here in Manitoba. We have been working with the college before this date for them to take the necessary steps. They're making the necessary regulatory changes to establish it. However, we have been working with them well in advance to get nurses from the United States and other jurisdictions on the front line more quickly. We have an NREP, nursing registration practice, a nursing registration expedited pathway program for internationally educated nurses that has about 80 nurses in it right now. Right? These are nurses who have been living, paying taxes, raising their families in Manitoba that for years never had an option. Right? They brought their names forward. They were knocking on the health minister's door and nobody was answering them. Nobody was talking to them. We very quickly established a pilot program that has been very successful. We already have folks who have graduated so that we can have these IENs on the front lines of our healthcare system. In fact, just this morning, I was in between meetings, so unfortunately I couldn't be there in person, but I was able to join a virtual call with a lot of these learners and tell them thank you. Say thank you for pursuing this opportunity to be able to get the necessary training or skilling up, whatever is required in order for you to practice in our province. These are folks who've been wanting to practice for a long time, and we're thrilled we're able to work with them and support them through our retention and recruitment office to ensure they have that opportunity. And certainly, U.S. trained nurses, we want them to have an easy, seamless pathway to practice in our province, which is why the college is making that change. But we recognize there's more work to do, and whenever there's a concern brought forward about delays in being able to do so, we work very, very hard to address it as quickly as we can.
Thank you, Minister. Honorable Member for Portage La Prairie.
Honorable Chair, thank you to the Minister for the answers to the question there. Through the Chair, I will provide an email with these nurses' names to the Minister within the next week. Going back to the MRI, Boundary Trails, my understanding from talking to the people down there, the Buhler Health Center, and the reason for the name of the Buhler Health Center is, my understanding is John Buhler and his wife wanted an MRI down there, so they basically paid for one and had one set there. My understanding is in Dauphin, there was some issues, much like that as well too, that the community wanted it and there was some heavy money went into that. Hypothetically, no, I don't want to say hypothetically. I take that back. Through the Chair to the Minister, if a mobile MRI was dropped in the Portage La Prairie Hospital parking lot, what would the Provincial Health Department do with it?
Thank you, Member. Honorable Minister.
Thank you, Honorable Chair. I'm not sure if the member poses that question in a lighthearted tone. I'm not quite sure. If not, I don't know that the member understands the seriousness of staffing. I don't know that the member is taking that issue as seriously as he should, and that concerns me. when I say that the previous government failed to adequately staff appropriately and take the necessary steps to staff the healthcare system or to plan, I don't say that in a lighthearted manner. There are real consequences for that Manitobans, including folks in his region, are suffering with as a result. I take very seriously the responsibility of training, retaining, recruiting, and staffing the front lines of our healthcare system. It requires an approach in partnership, it requires true collaboration, and it requires respecting the people who lead these initiatives in our province. And I don't really take the question, the member, and the way he posed it, I don't think that's very respectful. I've sat down with the experts in our province who do this work each and every day, who recognize that Manitobans are waiting, and they should not be waiting as long as they are, that we have to do better. And they're bringing forward plans and strategies in terms of how we can address that. I sit down with leaders every day who are committed to doing their part to make sure that we are retaining, training, and recruiting folks. That takes a real, sustained, dedicated, teamwork approach to addressing the staffing challenge that we face in our healthcare system. That is a national challenge. It absolutely is. But Manitoba was behind the ball on this because we didn't have the right focus and effort for 7.5 years under the previous administration. And so I would ask the member to be mindful of posing questions in that manner, because it really, to me, doesn't speak very respectfully of all of the experts, all of the partners who are working so hard to make sure that we're moving healthcare in a responsible direction that benefits patients and residents in rural Manitoba. Our government has been very clear that we will always be open to making sure that we are taking the necessary steps, listening to the right advice, and evolving healthcare, adding capacity, including diagnostic capacity, in that part of the province to meet people's needs. We must do it in a responsible manner. We must do it in a manner that can be sustained. Our government could have announced a mobile MRI for the north, and we could have just left it at that. But that would be irresponsible. We knew that we needed to do the work intensely to ensure that that mobile MRI would be appropriately and adequately staffed, no matter where it's going, and to have a true plan in place to make sure that those who have gone without it for generations will not continue to go without it for generations. That takes a commitment to not only establishing the technology, but staffing it and working with our partners to develop a plan that makes sense. And so I take very seriously the realities that folks in rural Manitoba in Portage la Prairie are facing. And our government is going to continue to take steps to ensure that they have more access, not less, that they have more capacity, not less. And that starts with staffing. That starts with training. That starts with making sure we can recruit people where they need to go, and to make sure that the hospital as a whole has the adequate staffing resources to deliver the care that folks in and around Portage la Prairie are counting on being delivered. And those plans were not put in place or addressed by the previous administration. And so we're all working very, very hard collectively to ensure that we're doing the work the right way, and that we can ensure that that site opens responsibly with staffing in order. To the member's previous question about foundations, and it's kind of woven into this question as well, just to be really clear, foundations, those are private dollars that are considered philanthropy, right? These are classified as donations by the CRA for accounting purposes. And foundations support, their investments support capital. That's where those dollars go, and are most always matched by government in those projects. Government has a responsibility. I'm sure the member saw the announcement more recently as a good example. For the first time ever in Manitoba's history, we have a surgical robot, right, at Health Sciences Centre. It's been operating for months and months. We wanted to make sure we waited, it was established, we had a good sense of what was going on there. And that was done in partnership with the Health Sciences Foundation. These are really important partnerships. I have the utmost respect for people who do that incredible work. And I want to give a quick shout out to Tina Jones, who was the chair for about 10, 11 years of the Health Sciences Foundation, raised massive amounts of money for Health Sciences Centre, and did it in partnership with government. The approach that we've taken with that foundation is to work in partnership so that when we make investments together, we know they can be delivered on for Manitobans.
Thank you, Minister. Member for Portage la Prairie.
Thank you, Honorable Chair. Through the Chair to the Minister, The talk of the question regarding somebody dropping an MRI into Portage la Prairie, it wasn't meant as a joke because it has been done in the past. I had a very large business person that had come to me and said, I want to do, because he said, I want to do like what John Bueller did. I want an MRI in the Portage Hospital. And that was my reasoning for the question. It wasn't to be smart. I know that we have issues with staffing. I know that the hospital, and I'm very proud of the past PC government for getting the hospital started in Portage la Prairie, the one in Neepawa and the one in Boundary Trails, because that may not have happened under this current government. So again, it wasn't a joke. It was meant as a question that was posed to me regarding an MRI. It's coming from people that I just want to talk about a person that told me 600 kilometers between Winnipeg and Dauphin to get an MRI, an appointment at 7 o'clock in the morning. This person was from the west side of Winnipeg and said it would be a lot easier to have that done in Winnipeg or somewhere that was closer. The only reason why I keep going back on this MRI is because of what we are seeing and what we continue to face. And again, the numbers that I quoted were the only numbers that were available to me through the website. So again, we do have the opportunity because there is Manitobans that are taking their MRI tech training remotely through Northern Alberta Institute of Technology and the BC Institute of Technology. What are we doing to make sure that these technologists have jobs here when they come back? And why are we losing them to other provinces right now?
Thank you, member for Portage la Prairie. Honorable Minister.
Thank you, Honorable Chair. Just provide a little bit of information for the member and cover off something that he raised. So I think I've already answered the question about technologist students and what we're doing to keep these folks in Manitoba. What I would say is that if he knows of individual students who are taking their education distance, right, in other jurisdictions technically, we would be more than happy to make sure that those learners also get a letter of offer before they graduate from our government. So the Premier and I want to make sure that all folks in Manitoba know that there's a job here waiting for them. So if he's willing to provide that information in addition to the other casework that we will take away from this estimates committee, we would be more than happy to ensure that those learners also get a letter of offer from the Premier and myself offering them a job right here in the province before they complete their studies. The other thing that I would say is that, again, Diagnostic Services Manitoba and our other partners, we work directly with them to understand what the needs are, how we use technology, how we maximize the efficiencies regarding diagnostics. Typically a scan, MRI scanner now, one of the size that we would use for a site rather like Portage la Prairie would be, they need to do about 9,000 scans annually. They can go up to 12,000 scans annually in terms of what you need to perform. The data that's been collected over the many months indicates that the Portage la Prairie demographic and surrounding communities would only ensure about 2,000 scans. And so the required scans in order to make sure it's utilized appropriately, we're not quite there yet. What I've said previously, and I will continue to say it, we will monitor and continue to monitor these areas very closely. We want to make sure that we are planning, we're being proactive in terms of when particular thresholds are met, that we can respond to that. We're positioned to do so. We want to make sure that should the time come where we're advised that now is the time for an MRI to be established, we want to make sure that we've got enough capacity to really maximize the utilization of that, that we have the people power in place to staff it, right? And so we're focused on staffing. We're making sure that our services can be delivered responsibly and sustainably. And we are always going to continue to listen to communities, Portage la Prairie, other rural communities, and in the north to ensure that as their healthcare needs evolve and as capacity evolves, as a government, we're making investments that can evolve alongside it. So just wanted to offer that information to the member and provided a little clarity, I think, on the learners that he's concerned about not staying in Manitoba. I'm equally concerned. I hope that the member will support us and work with us in making sure that they have a letter of offer and an opportunity right here in the province before they're done.
Thank you, Minister. Honorable Member for Roblin.
I thank you. We have no further questions and we're ready to move on to resolutions.
It's always nice when I get to learn information that's actually.
If there are no further questions, we would move to the question on resolutions. Resolution 21.2. Resolved that there be granted to His Majesty a sum not exceeding $16,970,000 for health, seniors, and long-term care, health policy and planning for the fiscal year ending March 31st, 2026. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.3. Resolved that there be granted to His Majesty a sum not exceeding $15,141,000 for health, seniors, and long-term care insurance for the fiscal year ending March 31st, 2026. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.4. Resolved that there be granted to His Majesty a sum not exceeding $31,669,000 for health, seniors, and long-term care, public health for the fiscal year ending March 31st, 2026. Shall the resolution pass?
Pass.
The resolution is accordingly passed. Resolution 21.5. Resolved that there be granted to His Majesty a sum not exceeding $4,767,000 for health, seniors, and long-term care, performance, and oversight for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.6, resolved that there be granted to His Majesty a sum not exceeding $19,604,000 for health, seniors, and long-term care, for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.7, resolved that there be granted to His Majesty a sum not exceeding $8,304,000 for health, seniors, and long-term care, corporate strategy and administration for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.8, resolved that there be granted to His Majesty a sum not exceeding $5,638,298,000 for health, seniors, and long-term care funding to health authorities for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.9, resolved that there be granted to His Majesty a sum not exceeding $345,157,000 for health, seniors, and long-term care, provincial health services for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.10, resolved that there be granted to His Majesty a sum not exceeding $2,039,596,000 for health, seniors, and long-term care medical for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.11, resolved that there be granted to His Majesty a sum not exceeding $466,088,000 for health, seniors, and long-term care, pharmacare for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.12, resolved that there be granted to His Majesty a sum not exceeding $238,510,000 for health, seniors, and long-term care, costs related to capital assets of other reporting entities for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. Resolution 21.13, resolved that there be granted to His Majesty a sum not exceeding $550 million for health, seniors, and long-term care, other reporting entities, capital investment for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed. The last item to be considered for the estimates for this department is item 21.1 bracket A, the minister's salary contained in resolution 21.1.
The minister's staff need to leave.
At this point, we request that minister's staff leave for the
Thank you so much.
leave the table for the consideration
Senator.
of this last
Thank you so much,
item.
JP. Appreciate it.
The floor is now open for questions. Honorable Member for Roblin.
I move that line 21.1A be amended so that the Minister of Health, Seniors, and Long-Term Care salary be reduced to $1.
Peanut butter.
It has
Henry?
been moved by the Honorable Member for Roblin that line item 21.1 bracket A be amended so that the Minister of Health, Senior, and Long-Term Care salary be reduced to $1. The motion is in order. Are there any questions or comments on this motion?
Shall the motion? Seeing none, shall the motion pass?
Shall the motion pass?
Ah, there it is.
I hear no. The motion is
All those in favour, please say aye.
all those in favor
let's see.
say aye. All those opposed say nay. In my opinion, nays have it.
The motion is according.
The motion is accordingly defeated.
Very quickly. Breaking some rules.
Resolved that, Resolution 21.1, resolved that there be granted to His Majesty a sum not exceeding $7,305,000 for health, seniors, and long-term care finance for the fiscal year ending March 31st, 2026. Shall the resolution pass? The resolution is accordingly passed.
This concludes the Department of Health, Seniors and Long-Term Care.
This concludes the estimates for Department of Health, Seniors, and Long-Term Care.
The hour being 5 p.m. Committee rise.
The hour being 5 p.m., the committee rise.
Well done, Chair.